Leviticus chapter 17, verse 11a. It says, for the life of the creature is in the blood. So even then, God created everything and knows the life is in the blood. Now, what is blood? Blood is a very vital fluid that is in the circulation of every human being and vertebrates, that's animals. It delivers nutrients and oxygen to cells and tissues and transports metabolic waste from those cells and tissues. You understand? So it gives the good one and take the bad one after the cells and tissues have finished using it. Takes the bad one back to the tissues where they will be excreted. So now what is donation? Donation is giving something to charity. So charity is like giving. You know, most times when you talk about donation, charity, people think of only money. Okay, I'm going to donate, it's only money. But blood too, in fact, blood is more important than money to me. So in a resolution by the World Health Assembly, that's resolution 28.75, they established the principle that blood donation should be voluntary and non-remunerated. So as we go on, I will explain to you what we mean by that. You understand? It should be voluntary. It should be something that you within you say, okay, I want to donate to save somebody's life. You understand? And it should be non-remunerated in the sense that it shouldn't be something that somebody will pay you to give. It should be something you come out voluntarily and say, okay, now I want to give blood to save life. So I will donate my blood for anybody. It can be used for anybody. So in essence, what I'm saying is blood donation is you give something that is vital in you in order to save somebody's life, in order to give another person life. Next slide, please. My system is not stable. Next slide, please. So blood donation helps to supply hospitals with blood for those in need. Because you can't get the blood anywhere. There is no factory where you go and say, okay, they are manufacturing blood. No. It is people that donate the blood so that hospitals will have keep in order to give those that are in need. Then in the US, according to American Red Cross Society, every 2 seconds, there is somebody that needs transfusion. Every 2 seconds. So just imagine, every 2 seconds, there is somebody that will need the blood. Then, I want to summarize in... There you go. Please, can I have... In Jude, that's just University Teaching Hospital, just close by here. Every blessed day, we issue out at least approximately 20 units of blood. That's just approximate, 20 units every blessed day. So in a week, you have like 140 units, isn't it? In 1 week. Then if you are talking about in a month, you have like 4,200 units of blood. So if you don't donate blood, where will we get the 2,400 units to give out to patients? So, and in the case of whenever there is mass casualty, the number of units that goes out increases. If there is any attack, communal clash, the number will increase. In fact, sometimes it will increase almost double, depending on the number of victims that are brought to the casualty. Next slide. Next slide. So for donors, we have criteria that we use to select donors. As I said, it's not just anybody that is it moving. Okay. It's not just anybody that donates blood. A blood donor must be a healthy adult. Must be healthy before you save another person's life. Then age between 18 and 60 years. That's what we take here. But it varies. In some countries, they take 16 or 17. But we take 18. The reason why we take it at 18, you know, adolescents are growing, so they need all the ions for growth. You understand? And in developed countries, you know, their welfare is somehow better than here. So a child of 16, 17 may be doing far, far better than somebody that is 18 here, nutritionally. Then 60 years, in some countries, they take 65. And 60 years, by the time you start getting to 60, above 60, you start having a lot of medical conditions, you know. So if you have any medical condition, not everybody, most people, if you have any medical condition, you'll be excluded from donating. The weight should be around 50, greater than 50 kg. We take your hemoglobin level. Hemoglobin is what carries the oxygen in the red cells to the tissues. So you must have adequate hemoglobin in your own system before you give another person. So for men, it's 13 grams per DL. Some people take 13.5 grams per DL for men. And for females, greater than 12.5 grams per DL for women. And also in donation, we have intervals. It's not that you donate today, tomorrow you come next. We have intervals. The minimum interval we take is 12 weeks. You understand? We don't like people coming less than 12 weeks because your system needs to regenerate those cells that were taken out of your body adequately before you give blood in. Then we take your blood pressure, should be less than 180 systolic, 100, less than 100 diastolic millimeters of mercury. Take your pulse rate, should be between 50 and 100, and it should be regular. We dictate any irregularity about it, you'll be excluded. Then your temperature should be normal. Then we have some exclusion criteria we use. Pregnant women and lactating mothers, because of increased iron requirements. So we don't want to deplete the one that you already have. You are pregnant, you are sharing with the fetus. You are breastfeeding with the baby. So we don't want to do that. Then if you have any non-cardiovascular disease or hypertension, if you have any significant respiratory distress, we exclude you. If you have epilepsy or any CNS disorder, GIT disorder that you cannot absorb anything, then you'll be excluded. Any chronic disease, because in chronic diseases, the iron that is stored most times will not be released for utilization in the system. So if you have any chronic disease, we cannot take blood from you because you need those stored ions to be released for red cells to be produced. Then if you have any ongoing medical treatment or you are involved in any clinical research, you'll be excluded. Then if you are a donor that maybe immediately after donating, they just called you or you just came, and maybe immediately after donating, you go back and you're a bus driver, immediately you just sharp, you go back to driving, or you fly a plane, or you drive train, or you drive train, or you work on heavy machines, or you're a crane operator, we exclude you because you may have delayed fainting attack. So most times, if you donate, you have to rest for some time before you go back to any of your heavy activities. So now, let's go to, let me add again. Sometimes there are some donors that we defer them. It's not that we exclude them completely, you're not going to donate. If you have taken vaccines, we give you between 1 week to 3 weeks before you donate blood. So let's discuss briefly about the types of blood donors we have. As I said, we have different types of blood donors. We have replacement donors. Replacement donors are donors that they are non-remunerated, directed donors. What it means is that you don't pay for them to donate, but it's directed because they are donating for a specific patient. So they donate for a specific patient. So that's why it says they are usually relatives of patients. And another name they are being called is family replacement donors. they donate for a specific patient. And surprisingly, it's what we commonly have now. Most people come to hospital to donate for their own patients. So they only donate to replace whatever you demand. If doctor says we are going to get 3 units of blood, they will bring 3 donors. Like the other day, a patient, I think it was requested for, was it 3 units? And surprisingly, like 8 people came to the blood bank, and only 3 people collected forms to fill. And all the 8 were hefty, good-looking young men. So when I now asked them, I said, and you collect, everybody collect form now and donate. They say, no. They just asked us to give 3. So finish with these 3 first. If it's not okay, then the rest of us will come. So then the family replacement donor has this type of donors, they have some disadvantages. Because most times, if you are compelled or you are under stress to donate, maybe your patient's PCV is very low, the doctors are on your neck, you need to donate, you go to blood bank, they say, there's not enough blood, though. You need to look for donors to come and donate. So in order for you to donate, because we give forms, you have to fill our forms. So most people tend to conceal important information because they'll be afraid. If I tell them that there was a time I shook myself with needle, they will say, I should not donate. So where will I get another person? Or if I tell them that I have hypertension, or I'm taking this type of drug. So they conceal important information that will help the patient. Then sometimes what happens is that because they don't have people to donate for their relatives, they now tend to go and look for people outside and pay them to come and donate. And those paid donors will come to that. I think it's the next group. Those paid donors, they have their own risks too. Because, if you are doing something for the financial benefit, when you come to blood bank, you will not tell us the truth because you want to donate and collect money. And sometimes some of them collect up to like 10,000, 15,000 from the relatives to donate blood. So most times they seek those paid donors, and those paid donors will conceal information. They will not give us the real information about how they are. And sometimes it surprises you. Some of them, maybe they have donated not up to 12 weeks. In fact, there was a time we had an incident. The person donated last week, and I don't know what happened. He now got someone again that needed blood. So he came to blood bank again to donate. So when he filled the form, he didn't give us the correct information. Unfortunately for him, the person that the recruiter had seen him last week. So when she saw him, she said, were you not here last week? He denied it. But she said, no. You donated blood last week. Tell me the truth. He said, auntie, yes, it's true. I donated last week. She said, no, you cannot donate. So he had to go. And sometimes, for the family replacement donors, when they donate blood for their patients, it must be that unit that will be transfused. If not, trouble will start. Even if you tell them that this patient will not need the transfusion again, they will tell you that no way they have donated. So what will you do with the blood now that you have collected? So they will insist that it must be that unit. We've seen several incidences of how people come, they give blood, there's their emergency, you take their own units. In fact, there's this particular one, she came, she donated, her colleague donated for her. So I don't know how, somebody came in their emergency. So they took the unit and gave the units out. When she came, she said, no, it must be those units. There were about 2 units. And her reason is that the person that donated for her, she's sure of the person. So how is she sure that the unit that we're going to give her is free of anything? So you see, those are the challenges that we always have with family replacement donors. So the second group, professional or paid donors, they are paid to donate, just as it is. And we discourage that type of donation because it undermines the voluntary non-remunerated system of blood donation, which is the standard. Then they have highest incidence of and prevalence of TTIs, that's transfusion transmissible infections. Because after all, it's the field form now. Some of them will do whatever it is, they will do drugs, they will do whatever, they will do tattooing, all these risk factors. But when it comes to field form, in fact, as the person is coming in, you see him, you say, Kai, this one. But he will fill the form and tell you he's clean. But who are you to query him? But in some dear stations, if we see the thing is too obvious, we'll tell you to hold on first. So, and they donate more frequently, as I said. They'll come, after 1 week, somebody comes, they'll come and give, they'll come, they want to give. You know, by doing that, they are depleting their iron stores. So which may not be good for them. And at the end of the day, the patient will spend more. Because you have a patient, imagine now that things are difficult. You have a patient in the ward, you are paying for bed fee, you are paying everything. You now have to go out and look for a blood donor. And maybe the blood donor will tell you, madam, situation I had, sir, situation I had is 20,000. Or you say it's 15,000. So because the patient relatives, they really need to get the blood, they will pay. At the end of the day, when they pay, you donate, you have to pay the hospital again for services rendered on the blood. So something that may cost you, let's say 18,000 or 15,000, you may end up spending 30,000. So these are some of the challenges we have. Then the voluntary non-remunerated donors. Their donations are non-directed. It's not directed for anybody. They donate for us to use for any patient, and you don't pay them for it. So that's the one that is encouraged now. People should donate voluntarily to save humanity. Donation to them is a principle. Okay, if you say, I come, I donate blood, then after 12 weeks, in fact, some of them, you don't need to remind them. After 12 weeks, they will go to National Blood Transfusion Services. Most times, that's where they go to, and just donate. It will interest you to know that most times, on a daily basis, people just walk in there and donate blood. And they are given cards. There is a card they give you. If you donate, the date will be written. Then the date for your next appointment to come and donate, it will be written for you to go there. So the reason why we promote voluntary donations because they have low incidence or prevalence of TTIs, transfusion transmissible infections. Because if you are not sure of yourself, will you carry yourself and go and say, I want to donate voluntarily? Most likely you will not do that. But most people that are sure of themselves, they walk there and donate blood. So we have the low risk of transmission of any infection in voluntary donors. They don't conceal information. They give you, most times, correct information. Because you are not paying them, so they are not concealing anything to you. So they are more likely to donate, willing to donate regularly. Because they are not financially motivated, so they don't donate frequently like the other paid donors that are looking for money. So whenever there is an appeal, say, okay, we need blood, donors should come around. The voluntary donors, because they have principle of donating, they always show up to donate blood to people. Like people that have rare blood groups, negative groups, it's very rare. So we have a register. Whenever there is needs, and you are due to donate, you just call, and they come, and they give the blood. So that's the importance of, without even asking you to give them anything. Then I would like to talk briefly about autologous donation. Autologous donation is donate for yourself. This one is mostly for elective surgeries. If you are going for surgery, you can actually donate for yourself. There's a procedure for that. You fill the form, we screen, and we'll tell you how you go about donating. So you don't need to depend on another person. We do your checks, we do your HB and everything. We do your HB is okay. Then we give you the protocols on how you donate for your own surgery. But you have to come maybe like 1 to 2 weeks to when you're going for the surgery. Then we'll do that for you. So if you know anybody, maybe elective surgery, and the person is okay, they can opt for that. You know, it has less risks of transmission of any infection. It's your own blood. So you will not be afraid of anything. So let's talk about benefits of blood donation. If you come to donate blood, you have the opportunity to have a free health check. We take your pulse, take your BP, body temperature, hemoglobin level. And the importance is that if you have any underlying thing that is hiding somewhere, we can pick that, it can be picked. Then you'll be advised accordingly on what to do. So you have that benefit. It's come for free checks. So it's already there. It can help to underline, to dictate any underlying medical condition, or if you have any risk factor for any disease. Then you have the opportunity to be screened for hepatitis B, hepatitis C, HIV, and syphilis. So it's free screening for you. Then if you donate blood, what happens is that you donate blood, your bone marrow produces new cells to replace the ones that you donated. So imagine I have cells that maybe, let me use age. Somebody that is cells that are maybe 50 years, and I'm having new cells that are 16, 17, 18 years. So which one will work better? The one that is young, Abi. So the young ones will carry the blood with full energy, deliver them fast. Take the bad one, deliver, and you excrete. Go back, carry oxygen, sharp, no wastage of time. But the old ones, they'll be doing lazy. They'll be moving lazy, wasting time. So that's the importance. You donate blood, your bone marrow replace them with new, let me use the word chassis cells. So if you donate regularly, it can reduce the risk of heart disease, especially in some patients that there's a condition we call hemochromatosis, where they store a lot of iron in their system. So if you donate, it reduces the blood, it releases the iron, so their iron content is being reduced from your system. Then if you donate blood, you'll be part of a greater community, in the sense that we have people that are voluntary donors. So they are like a community. So most times you see them in World Blood Donors Day. They come around, go for awareness, get more people. You get to meet new people. You know, you meet health workers, you meet different types of people. You make new friends. So there's nothing as great as that. You make new friends. And, you know, you benefit a lot from it. So let's discuss again about the hazard of blood donation. Blood donation can come with some few hazards, though it's rare, like fainting. Fainting most times occurs in people that donate for the first time. You know, you are donating for the first time, your body is shaking. Hey, if they remove this blood, what will happen to me? You are apprehensive, you know. So most times, first donors are young people, you know. So delay faints can occur. Maybe after you've donated, it's very rare, you've gone home, you know, you can actually faint occasionally. Then the site of the site where the blood is taken can be infected if it is not properly cleaned. So what we do, we clean it properly with spirit swab before we take. After taking, we'll use plaster to cover the place. Then bruising can occur too in difficult venous access. Some people, their veins, you sweat before you get it. So you keep puncturing, you remove your puncture, so it can give bruising. Now occasionally, it's very, very rare, because the people that do the phlebotomies, they are good. So it's very, very rare, but Sometimes things can happen, so they can go into the artery. And to prevent all these faintings, if after donation you rest, ideally you rest for 5 to 15 minutes, but some people, immediately you finish, they'll just, they'll stand up from the couch, they want to go. You have to rest first. After resting for some minutes, when you go, you take a lot of fluids, and eat. So in summary, I've said before, blood is life. Blood is the most precious gift that you can give anybody. Do you agree with me? Because it's life. Donating blood is simple and effective way to help others. It can give you emotional and physical benefits. Emotionally, you are happy. You have helped somebody in their need. And physical, your system will rearrange itself, as I've said before. Though it comes sometimes with some minor side effects, I've said. So when you donate blood, you should not be doing strenuous activities immediately. There are some people that are very hyperactive. When they finish, I'm not feeling anything. You start moving up and down. So you have to. You can resume most of your regular activities, but for the first day, less strenuous ones. Please, blood donation should be voluntary in all cases. That's what we are advocating for. You should have the sympathy to donate blood to save somebody's life. Financial profit should not be a motive for us to donate blood. Because if they give you 20,000, 15,000, it won't take you anywhere. You just finish it on 5 noodles of rice, 0 to, and you eat it maybe twice or 3 times. So then even those collecting the blood, like us collecting the blood from donors, financial riba should not be our main aim. When you are collecting, you shouldn't say, let me collect this blood and charge it and make gain. That shouldn't be the motive. I would like to conclude by saying, when you create a moment of kindness during a time of need, it does wonders for your mental health. If you help somebody in need, that person will never forget you. The person may not know your name, may not know you, but simply saying, God bless that person, that He can always bless you wherever you are. You don't need to see the patient. The second point was said by a young man that donated 16 times. He said, I really feel good after I donate, especially when I get a text message to say which hospital your blood has gone to. This one is in developed countries. They text them, okay, you voluntarily donated, your blood has gone to this place, this place. So a decision today to donate blood can save a life. We should donate blood to save people's lives. Before I say thank you, there is a very popular, I know somebody may ask me, so let me even answer it. There is a popular saying going around. In fact, surprisingly, even health workers do say it. They have said it to me severally. Excuse me. That we sell blood. Why do you think we sell blood? Somebody can start and tell me why. I want to know why. Let's clarify some issues now. No, why do you say we sell? Because of the money we charge? Okay, somebody wants to say something. Let's clarify.
Yes, the monies you charge, I think on many occasions, on personal instances, I've paid for blood. And I feel, and even when my patient don't use it, the next person I remember there's a particular, somebody else needed that blood. I said, okay, then they should give. The person had to pay again for that blood. I was like, why should that be? And this time was even when my sister-in-law even had another operation too in surgery in Garki. We paid for it, and somebody else also paid for that blood. I felt it's payment. If it's free that was given, the next patient should get it free. So hospitals charge.
Well, maybe what you're saying is, you say in Garki. In Jude, is it Jude? Okay, let me speak for my own hospital for Jude. When you donate blood, the money you pay is for the blood bags, the screening, the grouping, the cross-matching, and other services. The blood that is given is just the liquid. Because the bag we put the blood in, there is a liquid inside that will make the blood not to clot. So you cannot just take blood and put it in any bag, it will clot. And those bags, we buy them. Those reagents we do for grouping. You can't just take blood from my auntie here and give Madam Sarah. No. You have to group, and we buy those things. You understand? And what we do is that if we charge you for a unit of blood and you don't use it, you return it to the blood bank, they will put return unused. If they have charged you on your services rendered form, when they bring it back, we cancel it and sign. You did not use the blood. We don't charge, okay, you don't use it, we charge you, no. I'm talking for Jude, it's not for anybody. So I don't know other people what they do. You understand? And when you donate blood for me, that blood is for me. It's for documentation purposes. So I can't come, you can't just come and say I should give it to Madam Sarah. I've already documented that blood is for me. It's for man, so it's for man. If Madam Sarah needs her own blood, we'll get her own units and give her. Do you understand? That's how we operate. So if you donate a unit of blood, you don't use it, and you go home, and maybe in the next 2, 3, 4 years, you come back and you need to use the blood. Your blood is there. It's like a bank. Yes, it's a bank. We keep it in the bank for you. So when you come, your blood is there. We check our records. Yes, you've donated. And we get your blood for you. By any means, your blood must come out. Yes. Because it's your blood, it must come out. Ideally. Okay. I would like to say thank you very much once again. And I hope tomorrow people will come with their friends to save lives. Somebody wants to ask a question? Wait, okay.
Good evening again. Please, if you have questions, just write them down. We'll answer them later. She will be around. We want to have the second speaker. On approach to issues of fertility. She's no other than my Igbo friend, Professor OCHEKE, a mother of 4 children, a wife to 1 husband, Professor OCHEKE. You're welcome.
Thank you. Okay. I'm not your Igbo friend, I'm your Igbo sister. All right. Okay, good evening, everybody. I'm to talk about approach to fertility issues. Now, generally, fertility becomes an issue generally when people get married. Though sometimes it's an issue even for single people, but for us here in the household of God, fertility issues should not be a problem of youth fellowship. It should not be a problem of young people. It should be a problem after we have said I do and it has been signed, sealed, and delivered. Abi? Yes. So we know the right thing to do. So, young people, we need to do the right thing. Zip up for now, and let's not be talking about fertility. So, when people get married, the problem is, even from the wedding venue, from sometimes church, sometimes reception, we start praying for them that in 9 months' time, we will gather as we have gathered to celebrate. Abi? And then the pressure on the couple starts. You think you are doing a good thing, but you have started pressurizing them. So the problem now is when the woman sees her period, she's crying. Next period she sees again, she's crying. Interested mommies in the church will be asking, what is going on? Mothers, no changes. My daughter, what is going on? Then also colleagues at work who won't mind their business will be rubbing your stomach like they were doing to me after I got married. Ocheke, what is happening? And unfortunately, somebody like me, we had discussed with my husband that we will not. I told him that I didn't want to have children immediately, that I wanted us to wait a bit before we start. Not that we did anything, we just prayed. But by the 3rd month, I think, I started crying. Because I'll see my menses, I'll go and meet him, say I've menstruated. Then he'll be looking, I'm sure he was shocked that what's wrong with this girl after what we had discussed. But I was being pressured at work. Pressured at work. My so-called friends, nurses. Ocheke, what is happening now? Ocheke. So I didn't plan to be under pressure, but I was now under pressure. Then after we start having children, after a while, the people who were asking you what is happening will say, again? Again? You are pregnant again? Haba. Our sister, take it easy now. Haba. You know, the people who were disturbing you before are now disturbing you that you are now having too many children. So the challenge is when to stop, how many children to have. And remember, ICT, you are not projecting the slides, so we have started. Let's remember also in scripture, the word from 1 Timothy 5:8 that says, anyone who does not provide for their relatives, and especially for their own household, has denied the faith and is worse than an infidel or an unbeliever. So, it's expected that as Christians, we should have children that we can take care of, isn't it? So, we should work with that background. So, when we look at fertility, what is fertility? It's the quality of being fertile, being productive. And is the ability to conceive children. That's another way to look at it. And based on that, we need to consider, as I said earlier, if we want to have children and when we should have children. But you know that if in this society is not an option. You must born. You must born. Nobody can come out here and say they don't want to have children. That one is Oyibo something. Nigerians, we don't do that. You must, even if you don't want, your mother will want. And we want grandchildren. Even myself, I've started talking of grandchildren. So I'm also indirectly putting my children under pressure. So we will first look at contraception and family planning because they are fertility issues, but we won't dwell much on them. But the thing I want to raise is that before we embark on family planning or a family planning method, we need to get appropriate counseling and assessment before we begin to use family planning methods. So you shouldn't sit in your house and decide, we've had enough children. Okay, where do they say? Okay, that pharmacy over there, you go and start buying what they have available and start using. That is not advisable. If you decide you want to, for now, not have children for now, or permanently you want to stop, you are supposed to meet a certified healthcare provider of family planning services. And when you get there, they are going to ask you questions. Because based on certain things about you, there are certain family planning methods that you shouldn't use. So they need to ask you certain questions, take history from you, examine you, and find out whether you have certain issues. For example, if your weight is on the high side, you are obese, there are certain family planning methods you shouldn't use. If you are hypertensive, there are things you shouldn't use. If you are diabetic, same thing. If you are a sickler, there are family planning methods you shouldn't use. So you shouldn't on your own just decide that you want to do family planning and you just embark on a family planning method. You should be well advised before you embark on it. And I'll just raise a few family planning methods that are available. Maybe I'll start from the natural methods, the fertility awareness-based methods. in those methods, people understand their fertility. When they ovulate, they have different methods. I'm not going to go into all those details, but based on that, they know when to have sexual intercourse, when to avoid sexual intercourse, so as not to get pregnant. Then we have the lactational amenorrhea method for women who just have had babies and they are breastfeeding. When you follow the rule of breastfeeding, it says breastfeeding on demand. It's not breastfeeding when you feel like. On demand, that means anytime the baby wants, you must give. It's not easy, but that's how it works. If you are able to do that and meet some of those criteria, the woman will not get pregnant for at least 6 months. Most women. Sometimes we have some people who fall through the cracks. But normally, if you do breastfeeding on demand for the children for 6 months, you most likely will not ovulate, that you won't release eggs, and you won't get pregnant. Then we have the withdrawal method. I have a challenge there. I know many people do that, but there's a challenge there. The challenge is that most times before ejaculation occurs, there's already some seminal fluid that has already been released that you may not notice, and pregnancy can occur. And then the other challenge is that people have to be well motivated to be able to embark on that family planning method. You know how you need to be well motivated, because it can be a problem. I don't want to go into details because there are minors here. Then we have the oral contraceptive pills, which we know you take daily, every day. And for that too, people need to be well motivated, because it's not everybody that is willing to take drugs every day. And it has some side effects. One of the common things is headaches, and then for some people, weight gain. The other side effects I won't go into, but if you want to know more, you can see me after. Implants. We've heard of Implanon, we've heard of Jadel. People put under the arm, usually under the arm. A few people have put in the thigh, but usually under the arm, and it stays there for 3 years or 5 years, depending on the type. We have injectables, Depo-Provera, Noristerate, which we inject every 2 or 3 months. And some people have some side effects. Some don't menstruate. Some people add weight. Some people lose weight. It depends on the individuals. And we have patches. The patches work like combined oral contraceptive pills. There's a patch that is put on the body. Sometimes it lasts for a month. We generally don't have it available around here. And vaginal rings, they are put in the genital tract. And also for a period of time, sometimes a month, as a family planning method. Then we have intrauterine contraceptive devices that is put into the womb. People commonly call it the loop. Lasts about 7 years. People can use for up to 7 years, 7 to 10 years. And then we have condoms. We have both male and female condoms. And then we have male and female sterilization. Those are permanent family planning methods. For women, bilateral tubal ligation. For men, vasectomy. When you embark on this family planning method, you have decided that you have burnt your bridges. There's no going back. Because we've had patients that have done BTL, and after a while, they decide they want to have children. They start looking for us. And those patients, you see everybody, whenever they come to clinic, the doctors are dodging. Say, she has come again. Everybody's finding where to go. Because what are you going to do? And then they have been canceled. They signed documents to agree to it. But unfortunately, for whatever reason or certain things happen, people come back and want to reverse it. But you should have in mind that it's supposed to be irreversible. So if you decide for that, you are done. There's no going back. You just wait for grandchildren, like me. We are waiting for grandchildren. Okay, that's for family planning. So we now go to the issue of infertility. When we talk of infertility, it's inability of a sexually active couple who are not using any birth control, any family planning, to get pregnant after 1 year of regular sexual intercourse. This is very important, because there are people who come to disturb us that they are not getting pregnant, but they are not having sexual intercourse, or they're having sexual intercourse maybe every 3 to 6 months. I don't know how you want to get pregnant. That doesn't work. Or we've also had people After investigation, we found out that there was a family planning. There's a lady we found out that had an intrauterine contraceptive device inside. It was there. And she had been coming for infertility investigation. It turned out that she got pregnant as a young single girl. I think she got pregnant once or twice, and her parents were tired. So they took her to a doctor and they put an IUCD so that whatever she does, belle no go enter. And they didn't tell her. So when it was now time, she got married. She was trying to get pregnant. It wasn't working. So when she came, we now asked her to do HSG, a special X-ray that we do. We saw an IUCD inside there, which we now removed. But this definition also, and that means if you've been married for not up to 1 year, please don't come and disturb us and take up our clinic time. Just stay in your house. Be doing what you are supposed to be doing. And when we are saying regular sexual at least 3 times a week, continue. When you have done it for 1 year, you didn't get pregnant, then you can come and disturb us. If not, if you come, most times we'll drive you back. Unless there's a problem that you can identify and tell us exists. However, we'll make an exception to the rule. A woman who is over 35 years, 6 months, you are not pregnant, please come. Because for that, we know that we are racing against time. So after 6 months, no pregnancy, that one we will attend to you. Then just also for us to know that 80% of couples will conceive within 1 year of unprotected intercourse. So calm down. Calm down. Within a year, 80% of people will get pregnant. But some people, after 2-3 months, they're already disturbing. I'm saying my parents. I say, just stay. Just you people be getting to know yourselves. Just leave us for now. After 1 year, if nothing happens, come and see us. Then some, they are just waiting. That's their anniversary. Bam! They have called you. Then some while we're still talking, trying to book appointment, say, the Lord has done it. I said, but I told you. Wait. Then 90% will conceive within 2 years. But usually after 1 year, we begin to do something for you. So causes, we have male factors, issues from the man will cause infertility in about 30% of couples. Issues with the woman will also account for 30%. Sometimes both of them, the male and the female, have problems. That will account for 30%. And we also have 10% that we don't know why they are not getting pregnant. Everything looks normal, but they are not pregnant. But we must always see things that tell us that we are not God. We must always see things that show us that, as Nigerians say, God pass us. So those ones we do not know. So when we look at male factor, the problems from males that may cause infertility, we have problems with the spermatozoa. So the sperm cells, either some people do not have sperm cells at all, or the sperm cells, they are very few. Unfortunately or fortunately, there's just a way it is. You just need a number of sperm cells to be able to get pregnant. Some people will say, is one not enough? One is not enough. There's a way it is. That one that will do the fertilization needs escorts to escort it to where it's going. So you can't go alone. You must have escorts. And the escorts must be enough. If the escorts are not enough, problems. Then also we look at the shape of the sperm cells. Some sperm cells are not normal shaped. Some people have sperm cells that are not normal shaped. Or that do not move. They may be sperm cells, but they are not moving. I know sperm cells need to move to get to the egg to fertilize it. Then female problems. We could have damage to the fallopian tubes. We could have hormonal problems. We could have cervical problems with the cervix. We could have problems with the uterus. And I said some problems, some infertility issues, we don't know why. They are unexplained. Then we also look at some associated factors. Pelvic inflammatory disease, when people have pelvic inflammatory disease, is an infection or a disease due to infection of the female genital tract, the fallopian tubes, the ovaries, and the tissue surrounding it. And people who have those kind of problems tend to also have infertility issues because in the process of the infection, the tubes become damaged. But it's not this one that people make diagnosis of PID for you everywhere and you go and scan and you come and tell us you have PID. No, we have clinical signs and features that must be there before we can make diagnosis of pelvic inflammatory disease. Then endometriosis. Endometriosis is a disease condition. For some reason, some people, the tissue that lines the inside of the uterus is found in other places. like the ovaries, is found in the tubes, is found in the pelvis, causing damage and inflammatory problems all around. For some reason, some people are like that. Then ovarian aging. As women get older, the chances of getting pregnant become smaller. And unfortunately, some women, their ovaries finish all their work before they even get to 40. That's what we call premature ovarian failure. Interestingly, women, when women are born, they are born with all the eggs they are going to use in their lifetime. So no woman produces new eggs. The ones you are born with is what you use still. So menopause means that all the eggs are finished. That's when you have menopause. Unlike men that continue to produce sperm till whenever. But women, you are born as at birth. All the eggs you are going to use in your lifetime are already in that small baby. So no new egg is produced. So once the egg is finished. Then some men have something we call varicocele. I don't even know how to begin to explain, but just know that there's something about that varicocele that causes too much heat in the sperm bag and causes damage to the sperm. Then toxins, previous abdominal surgeries can cause adhesions and will cause problems there. Cervical uterine abnormalities, previous surgeries can also cause problems for you. Uterine fibroids, if the fibroids are located at the cervix or they block the tubes, can also cause problems for you. Now, infertile couples also have emotional needs. And remember that this problem is a couple problem, not an individual problem. Because many times, it's the women who come to the clinic and the men refuse to participate. So we are begging, Oga, please come. Oga, please come and do tests. I will not do tests. I got somebody pregnant before. I will not do tests. I have another wife. I will not do tests. But you know that the fact, just like women too, the fact that you're able to get pregnant or get somebody pregnant does not mean that things cannot malfunction later. You get it? You get it? Yes. So if you don't get it, but I won't say you forget about it. You still get it. Because people just assume that, hey, I've gotten somebody pregnant, I already have 2 children, I don't have problem. It's not true. You can have 5 children and have problems later for different reasons. So when we are asking that the men should come, please, they need to come because there may be problems. Then the other emotional needs, sometimes people feel guilty. Either because of things they have done in the past or things they felt they should have done that they didn't do. So sometimes people begin to feel guilty. Oh, if I had known, I would not have become sexually active before I got married. Oh, if I had known, I would not have done that abortion. Oh, if I had known. Maybe some of those things may affect fertility, but sometimes it's not the case. But sometimes people deal with guilty feelings. Then the issue of where to go for information. You need to get the right information. And that's why we are organizing, the health committee has organized this program so that people have right information. Because people move around with very wrong information and pass it across and talk as if they are experts in the matter. Meanwhile, they know nothing. And even when you try to raise, they say, don't talk. We have been there since. You know, have you had that experience? Mommies in the house, you know yourselves. And you know the kind of things you say and do. Like I remember when we had, this is not an infertility issue, but I remember when we had our first child. Those who came to greet us and came to help us birth the baby started. And my husband said, no, this is not how you do it. What do we know? We are experts. I should forget that thing we are saying we are doing. My husband is pediatrician, me obstetrician. You are coming from outside to teach us what to do. That our own is just theory. Their own is real and practical. So my husband said, if you will not do what I want, you can go. There's nothing in batting baby. I can bat baby. So we know some of those tales that we carry around. You people are looking at me. Mommies, you know you people are the most guilty. You can carry gist up and down that is not correct. So please don't listen to them. Come for the correct information. We will give you the right information. Though they will still tell you that don't mind them. They are just talking theory. We're telling you the real thing. Some of this, you know, is coming from the village. It's your grandfather, it's your grandmother, it's your great-grandfather, it's that goat that passed. You know all those things they tell you. Anyway. So they also need to have options. Know their options. And then get over or deal with the feelings of frustration and anger. And also the support. We need support. People who have infertility issues. Now, when you come to hospital, we are going to evaluate you and look at the different parts of the body associated with fertility. Now, the most important factor in evaluation of infertile couple is history. That means the questions that would ask you. General history. We want the couple to come together. We want them to come together. But most times our story is that it's the women who come alone. But we want them to come together because they both will provide information that we require. And there are some things about the man that the woman may not know. So we need both of them to be present. We want to know their ages. You'll be surprised how many people are not sure of age or how many people lie about their ages. I remember, I think it was 2 years ago, a couple came for infertility. I looked at the woman. I said, this woman, this is not a small girl. She told me she was 29. But I took time to ask when she finished primary school, when she finished secondary school, and when I calculated, there's no way. I said, Madam, you cannot be less than 35 years as we're having this discussion. The man shouted. He carried his phone. He started calling his mother-in-law. Mama, when did you say my wife was born? So we need to know these things. Then previous pregnancies by each partner. You need to know if you have ever been pregnant before, whether you had a baby or not. Length of time without pregnancy, how long you have been looking for this pregnancy, where you have gone, what you have done. Then sexual history, how often you're having sexual intercourse, frequency, use of lubricants, impotence, contraceptive history. You need to know all these things. And some you would have realized from what I had said earlier. Then from the man, we want to hear history of sexually transmitted infections, whether they've had radiation for whatever, for cancers, toxic exposures, including drugs, whether they've had mumps in the past. Mumps is a very dangerous disease, especially for the men. Yes, it's dangerous because it can also affect the testes. And if it does, it can stop production of spermatozoa for the person. So they grow up with problems. So that's why if your child has mumps, you need to take it seriously. Don't just watch it and say, hey, it will go. Make sure you give it the appropriate attention it requires. Okay. Then whether they've had testicular surgeries or injuries to the testes, excessive heat exposure, the kind of underwear they wear and where they sit. People are also thinking or trying to allude to the computers, laptops that you put on your lap, because sperm problems or male infertility problems are on the increase, and people have been postulating different things, what could be causing it. And one of the things people have been looking at is the use of laptop. So please, men, we know the name is laptop, but don't put it on your lap. Put it on the table when using it. Then for the women, we want to ask about previous surgeries, pelvic inflammatory disease, as I mentioned earlier, appendicitis, because the appendix and the tubes are close. So you can have appendicitis and it will affect the tube that is close to it and can even cause blockage of that tube. So it's something that you need to look at. Contraceptive history, whether the woman has been pregnant, irrespective of where the pregnancy was placed, whether she's had an ectopic pregnancy before, whether she's had endometriosis, whether her menses are regular and all that, whether she has vasomotor symptoms, internal heat, all those things that point to menopause. Whether she's been under some stress, whether there are weight changes, drastic weight loss can affect fertility, and also plenty weight gain also affects ovulation. So those things are also important. Exercise, women that do extreme exercises can also have problems in achieving pregnancy. I'm not saying you should tell women not to do exercise, but extreme, like gymnasts and all that, sometimes they don't even menstruate because of the extreme nature of it. Then when not to pursue infertility evaluation. If patients are not sexually active, we'll drive you back. Go and do what you need to do to get pregnant. Only Jesus was born by immaculate conception. Abi? Every other person, there must be sexual activity. So if you are not having, please go and do the needful before you come back to us. If you are not in a long-term relationship, we're wondering, is this working? Is this something that is getting pregnant? Because people come, they just want to get pregnant. They are not planning to marry. The man is not saying anything. He doesn't want to marry me, but I want him to get me pregnant. You know, that one is a problem. When patient also declines treatment, Sometimes you talk, they say they don't want the treatment that you offer. You have to stop. And then when couples do not meet the definition of infertile couple, as I mentioned earlier, you have not been married for up to 1 year and you are disturbing us, you are not up to 35 years of age. We are not going to worry until when it is time. So after taking a history, the people need to be examined. We look for the men, we look at the size of the testicles, whether the testicle has descended, because there are some people, their testicles are in the abdomen or somewhere in the pathway, because in development in the uterus, when the babies are still in male fetuses are still in the uterus, the testis begins from the abdomen and descends into the scrotal sac. Some people, the descent is arrested somewhere along the way. And if it is not dealt with early, because of the heat from the abdomen, the person's testis will not be producing spermatozoa the way it should. So that's why also for people, when you have babies, please examine your baby boys and be sure that there's something inside that testis. All right? Yes, inside the scrotum, sorry. Yeah, be sure that there's something inside the scrotum. We'll move on, I'm sure. How much time? Oh my goodness. Okay, let me just go to, okay, these are the investigations we do. Most importantly, we need to examine the man for seminal fluid analysis. We will do laparoscopy, we'll do some blood tests to check whether the woman is ovulating or not, ultrasound scan, special test, HSG. Then the treatment will depend on the cost. And the treatment outcome will be affected by the age. You know, the older a woman is, the less likely her eggs are good. So for those who are going for IVF, usually when women are 40 and above, they tell them to go and get egg donors. And women don't like to hear that. But that's the truth of the matter. Weight, the bigger the weight, the less likely your procedure will succeed. Smoking, alcohol, drugs. So based on whatever it is that the doctors find, they may give you drugs, they may do surgery, they may do artificial reproductive techniques like IVF, surrogacy, and then adoption is also an option. Okay, I'm going to jump all these things. Then for us as a church, what we will do for people who are having infertility issues, we need to inform ourselves, which is what we're doing. We need to be empathic. We need to be empathic. Don't think ahead. Say all these girls of nowadays, that's how they spoil their womb before they marry. Now they can't get pregnant. Who told you? Who told you? Pregnancy is the grace of God. If you know all the things that can go wrong, and even the ones that don't have problem, you know that every pregnancy is a testimony. Then pray for them. Pray for them. Encourage them. And then you need to earn the right to ask questions. The fact that you see somebody around is you don't have the right to ask, Amaka, why are you not yet pregnant? Are you my friend? Do you know me? Have I ever had a discussion with you? Why should you ask me that kind of question? So please, let's be sensitive in the way we ask questions and who we ask questions. You need to earn the right to speak into people's lives before you start talking. You have never greeted me before. You have never visited me before. You have never called me on phone. It's pregnancy you want to discuss with me and you want me to discuss with you. And when I don't discuss with you, you say I'm rude. You self-check it now. You self-check it. If I come and start asking you questions about yourself, I'll say, hey, Dr. Ma'an, why are you short? Why is your shoe size 6? Should she answer me? Why? Why should she answer me? I must have a relationship with her. She has to be my friend. We have known each other for a while. I say, my friend, this shot that I can even joke about it. This shot that you ask, if like they didn't feed you well, then we'll laugh. But if she's not my friend, if I crack that type of joke, it's called an expensive joke. So you earn the right to begin to ask questions. Yes, I know you are concerned, but if you are not close to the person, please don't go and be asking her, why are you not pregnant? What is happening now? We are waiting, though. We want to come for child dedication. All of us want to come for child dedication, but it has not worked. So please be sensitive before you ask questions. So infertility, yes, is a common problem, but it's a disease of couples. It's not one person's problem. Consult a specialist, though. Evaluation must be thorough and individualized. Treatment is available, including IVF, but it can be expensive, invasive, and then in some cases, it may not work. Thank you.
Thank you very much. If you have questions for Prof, you can write it down. Meanwhile, we call Dr. Ma'an to answer the questions with her.
have some few questions here. The first question. Why is it that blood given in Plateau Hospital, I think maybe the person wants to mention MBTS, is given at the cost of 10,000, while in truth is 18,000. This is MBTS that gives blood at 10,000. So MBTS is in Plateau Hospital, but there are two different places. Most people make that mistake. They go, when they say go to MBTS and get blood in Plateau Hospital, they go to MBTS. They go to Plateau Hospital Blood Bank instead of MBTS. MBTS is the one close to the mortuary. Yes, that's MBTS. I just want to, so that you know the difference. Okay, the reason is that in MBTS, they just take the blood in the bank and group. That is all. And they screen. They take the blood, group it, and screen. So you cannot collect blood from MBTS and transfuse straight to the patient. You have to bring it to the blood bank, and we cross-match to make sure that that blood we are giving is compatible. What I'm trying to say that, so that we'll make sure that if you are giving the patient the blood, the donor does not have antibodies that will destroy the patient's blood. So in MBTS, they only screen and group. And then this one is A, this one is B, this one is AB. You understand? This one is O, either positive or negative. So if they bring it, we have to cross-match. And in cross-match, we use reagents. It's not just water and blood you use. There are reagents we use cross-match. So we can't charge 10,000 like MBTS. I hope I've answered. Then the second person said, please kindly enumerate what is involved in blood screening that will help people, so that people will know and appreciate the cost of the unit of blood. Well, thank you. So what's involved in the screening is when you donate your blood, we screen and we use ELISA. And for each of the TTIs we screen is a lot of money. In fact, a blood transfusion used to be cheaper than that. But first of all, the cost of the bag. The bags are expensive. Since 2023, last year, everything in fact, every day things are, the way rice and beans and other things are going up is the same thing. You call for blood bags. After 1 hour, you call, they'll tell you the price has changed. For screening kits, it's the same thing. So that's why so you have to charge for the blood bag, as I've said before. The screening, after screening, you have to group the patient. And all this, we use reagents. And the reagents for each group is different. And all costs money. When you group the patient, you have to cross-match. And all involves reagents. So, and as we know, things are skyrocketing. And we're hoping that it shouldn't be more than the 18,000. I was told that women don't donate blood because of the monthly for menstruation. Women donate blood. The only women that will not donate is pregnancy and lactation when you are breastfeeding. But if you are menstruating, you will lose blood every month. And as you are losing the iron, your system has adjusted to the specific level of hemoglobin you have. So if we take blood from you, it won't cause any much harm for you. You understand? So women menstruating, they donate. It's just that sometimes you give them a longer time. Instead of 12 weeks, you can give 16 weeks for them to come and donate again. So before you donate, we have to check your HB. If you are not qualified, you cannot donate. But menstruating women, if you're a woman that is menstruating, you can donate. Then, how many times is one who is a donor entitled to have free blood? This one is in Jude. If you are donating, we don't give free blood. It's a voluntary donation, so you donate to save other people's lives. You understand? But then, in NBTS, I don't know of now. Initially, what they do is that if you're a regular donor and you are ill, you need the blood, they can give you a unit or first degree relative. They can give. But along the line, they had some issues, and I think it was either now restricted to you yourself, not your first degree. But I think, I'm not so sure, but I think they're trying to change it now again, back to first degree relative. They give at least a unit of blood free. If you're a regular donor, sorry, that means you must have your card and you've been donating. It's not the one that maybe you donated like twice and in 5 years you have not appeared. No. You have your card and you've been regular in donating blood. I thought somebody gave me. You said blood will be present no matter what. I thought blood has expiry date. Of course. For the bags we use is 35 days. So if blood, no matter what, blood must be there. What I meant was, it's not that it's that blood that expired that will be there. What I meant is, we must have blood in the bank. As blood is expiring, we remove them and discard. Then people donate and we keep. It's just like we're having a bank. It's just like a bank, the normal conventional bank. Money is always in the bank, isn't it? So that's how it is. Blood bank is just like mine. You deposit, you withdraw. And if you don't have, we give you loan. Then you return it. Okay, I've answered the second one. Can a menstruating lady donate blood? Thank you very much. Please, I want to make an appeal. Let's come out to donate to save lives tomorrow. Thank you.
Thank you. When bilateral tubal ligation is done on a patient, can't IVF work? IVF can work. Can endometriosis cause infertility issues even after a surgical procedure? The problem with endometriosis is that sometimes it can be widespread. It can be all over the pelvis, everywhere. There are some people, because that's why endometriosis even has stages. 1, 2, 3, 4, and it can be very bad. Some people all over the pelvis, and sometimes those people have something we call frozen pelvis. You see adhesions everywhere. You can't even see the tissue properly. So for those kind of patients, it can be a problem. And for some, even IVF sometimes may be difficult or may not work the way you want it to work, but that's it. What is the role or place of high-level prolactin in fertility or infertility management? Now, prolactin is a hormone that is produced more when women have babies. So when they are breastfeeding, it helps in milk production and letdown. Unfortunately, some people outside pregnancy, for some reason, sometimes there are tumors in the brain, sometimes just like that, they develop high levels of prolactin. And many times it manifests by them producing breast milk, even when they didn't have a baby. Yes, it affects fertility because such women generally will not ovulate. So we need to give drugs to bring down the level of prolactin. Sometimes we need to have surgery if it's a brain tumor. And then when it is down, we now induce ovulation and the woman can't get pregnant. Mumps. How does mumps affect male sexuality? I thought mumps affects the throat. Short, Chief OCHEKE, just talk about mumps because it's a childhood illness.
Anyway, the body is very interesting, intricately related to some extent. Mumps does not affect the throat. It affects the salivary gland. There's something here. This way, okay, let me explain. When you are eating food, the food is lubricated by saliva. That makes it easier for you to swallow the food. Now, the glands that are responsible for that are called salivary glands. There's one here, it's called parotid. There are some here. So once there's food in your mouth, they start pumping the saliva inside your mouth to make the food softer and smoother for you to swallow. So that is the function of the salivary gland. So mumps is Boys can have it, girls can have it. And you see some boys, this place will start swelling. When they go to school, you come back and then it's, you know, there's a virus that causes mumps. It's called mumps virus, just like measles. Measles and mumps virus, they are related. They are like sisters. So in developed countries, the vaccines for measles are combined with mumps vaccine as well, so that you are protected against that. But we don't have, it's not included in the national program of immunization in Nigeria, so we still have cases of mumps. So when you have mumps, when there's a swelling, especially those who have associated fever, high-grade fever, there's the virus, there's an, well, something to make sure the disease progression is limited. So some proteins, some things are produced against the virus, and that thing also affects the testes in boys. That's why it damages the cells that are responsible for production of the sperm cells in boys, and then result in infertility. And infertility is also associated with malnutrition. Children that are poorly malnourished in the first few years of life also have greater risk of infertility as well. And then let me just make this comment because I don't want to make another comment again. And that's to show you the wisdom of God, especially for the men. Our body temperature is very effective, very important in the sperm cell production. So for boys, you discover that when it is very hot, the skin of the scrotum becomes smooth. The scrotum comes down, moves away from your body so that the temperature is maintained. And when it is cold, the skin becomes corrugated and it goes up closer to your body to keep the body temperature, so that's how God designs the scrotum. So there are so many things in our body that works in such a way that we are not aware. I think that answered the question. And then the question on the screening for blood. The blood is screened against hepatitis B, hepatitis C, HIV, malaria, and then syphilis. So these are the various infections that when you donate blood, it's screened against these infections to be sure that the donor does not have any of these conditions. If you have it, they won't give your blood. Okay? So I think I needed to say that. So we know what the screening that is done in Jute entails.
For further questions on moms, meet Ocheke outside after the program. Why do people find it difficult to have children? Is it because they have some common infection? We've talked about this one. Is there a cure for all those diseases that a woman and a man get? How do you cure it? We've made presentation now. Hassan is even doing you. You want to suffer my sister. Hassan, tell them. They want me to be talking. Why would a married woman not get pregnant for up to 6 years and end up getting pregnant? Maybe the things that were preventing her from getting pregnant have been sorted out, and she is now pregnant. Also, the Lord may intervene and do marvelous works the way he does, wonders that we have not seen, and she gets pregnant. Hallelujah.
You can do more than that. Very much for coming and for listening. In Sunday school, we will say there is joy in sharing. Please come tomorrow and share your blood with us. We will appreciate. Thank you very much. And if you have any infertility problem, please visit the hospital. Thank you very much.
If you are coming to donate tomorrow, donate blood. 1 day, 2, 3, 4, 5, 6, 7, 8. Okay, I've counted 8 people. That's your donation may be what to save somebody's life, literally. So please think about it. Those that are not sure, consider it. Get more people that are willing to donate and come out tomorrow. Let's save lives. So tomorrow we have another set of interesting talks. Tomorrow we'll be talking about good news. This is the time when you clap. So the blood donation will be extended to Sunday after service. So we'll donate tomorrow, we'll donate on Sunday after service. In case there are people that are coming in from out of town that may not be here tomorrow, please tell them they can still come and prepare to donate on Sunday after service. So tomorrow, we're going to be having a talk on mental health and rest, the one we missed today that we had to swap for the issues of fertility. And then we're also going to have common illnesses of the liver, kidney, and the lungs tomorrow morning. So it's going to begin by 9 a.m. So please, let's be here on time so that we can all begin together. Then tomorrow, after the set of talks, we're going to have general health screening for those that are interested in being screened. We're going to have some tests that will be done for diabetes, we check for hypertension, and other general illnesses. So please come out. Tomorrow we're going to take people that are interested in donating blood. There's going to be tests for those that have indicated interest for prostate cancer screening. We've already collected some names, and many other. There will be eye checks. So tomorrow is full. So you can lock down tomorrow and come here so that we would all benefit together from what God has given us in this church. So I would call the church secretary to close us in prayer. But before then, I also ask him to pray for the son of the speaker tomorrow, Dr. Anna Gyang. Her son was taken to EPU. That was one of the reasons why she couldn't make it with us today. So I'll call the church secretary to close us in prayers.
Let us pray. Our Father and our God, we thank you again for the privilege that has been ours to listen to these two talks on blood donation and infertility. We are grateful that we are counted among the living. And we ask, O Lord, that you will help us to use the knowledge imparted for the better of ourselves and our community. We want to pray for Master Gyang, who was rushed to EPID unit this evening. Father, you are the great physician. You know what the challenge is with his health. Father, we ask that you apply to him the balm of Gilead and restore him to fullness of health in the name of Jesus Christ. And we pray for our sister that you will grant her grace as she takes care of him. And that, Lord, you will free her to come and speak with us on mental health tomorrow. Again, Lord, we thank you for every soul that is present here this evening. As they go home, Lord, we ask that you will go with them. Make crooked ways straight. And we ask, Lord, that you will bring us back tomorrow in safety. Take the honor, Lord.